So we have several members of Congress who are going to drop in, and so when they come, we'll work them into the program. We had several members who wanted to come speak, which is a great sign. So we will turn now to our panel two. So if I thank you for your movement, and if anybody in the audience wants to get up and take a stretch break, that's good too. So again, I'm going to welcome Jennifer Pomeranz, Arvin Singh, Robert Paarlberg, and Kyle Diamantas for our second panel, really thinking about the federal and state actions that are going on. There's a really exciting work going on in the states. The states are, in 2025 alone, doing remarkable things around ultra-processed foods. And so I'm going to start with you, Arvin. As the Secretary of Health for West Virginia, what's West Virginia doing around ultra-processed foods and nutrition more broadly?
Thank you, Darian. Thank you for having me here today. So in West Virginia, we decided to act instead of just talk. And earlier this year, our Governor Morrissey, and our West Virginia legislature overwhelmingly passed, at over 80% in both the House and the Senate, one of the nation's strongest and strictest food dye bans that would protect children and communities from these unnecessary dyes. And it went beyond just petroleum-based food dyes, which are your red dye 30, red dye 40, but we also went to the preservatives, the BHAs, the BHTs, the propylparabens that serve no nutritional purpose. And we did it responsibly. We had the schools go into effect in August already of this year, so they're already complying with that ban. And we have now asked that retail across the entire state of West Virginia go into full compliance by January 1st of 2028. We felt that was responsible. It was economically correct to allow the manufacturers enough time to retool and reformulate to be able to effectively meet our legislative ask for that. In addition, SNAP. For SNAP, we submitted to the USDA, and it was approved in August of this year, that we would have a waiver that would restrict soda purchasing through the SNAP program. That way we meet the intention of SNAP, which is supplemental nutrition, not to have soda in those diets. In addition, that will go into effect January, so just a few weeks from today. And in addition, we also have our WIC program. We've been redesigning our WIC shopper's guide to be effective, to have nutritional safety in what we're giving to our women and children. So those are some of the efforts we're doing across the state of West Virginia to really protect our communities and our children.
Thank you for sharing that, Arvin. There are multiple states now taking action with at least 30 bills proposed and I think 10 passed around ultra-processed foods and at least 12 waivers around SNAP that have been approved and others pending. And so, Rob, you're a political scientist who's thought about the SNAP program for years and how to prioritize nutrition. And for example, you've written a paper about the iron triangle of resistance to improving nutrition in SNAP. Tell us about this last year. What's happening, what the history was to get us here, and what you think about the state actions.
Yes, it's been a revolutionary change in 2025 in the SNAP program. Before this year, when states asked USDA for permission to place a restriction on the sale of foods through the SNAP program, the Secretary of Agriculture always said no. Democrats, Republicans, it was always no. This year, influenced in part by the MAHA movement, we've seen a major change. 12 states, including West Virginia, petitioned for a waiver to place restrictions on ultra-processed foods, mostly soda, but also candy, and in at least one case, prepared desserts. And the Secretary of Agriculture approved all 12. So this is a big change. But I want to be careful here about some of the risks that we might encounter going forward. One is definitions. What's candy? If I'm a SNAP participant and if I want to buy an energy bar, am I going to experience a shaming rejection at checkout if that's classified as a as a candy bar. We don't quite know how that's going to work out. There are 12,000 new products introduced into the U.S. food supply every year. Until now, the U.S. Department of Agriculture hasn't wanted to introduce new restrictions in the program because they don't know who's going to keep an updated inventory of which products are SNAP legal and which are SNAP illegal. A second problem is what I see so far is an absence of any plan to do careful state-level studies of the results of these waivers. The waivers are temporary, only for 2 years. The purpose originally of having this waiver option was to learn what a change would do to dietary health. The states that have received these waivers so far, I don't see a lot of evidence that they have careful plans along a baseline to see if soda consumption actually comes down or do out-of-pocket expenses compensate for the SNAP blockage. Another problem is, frankly, what else is new? Partisanship. 11 of the 12 states were Republican states. And Republicans and Democrats have different views of the SNAP program. The agenda in some Republican states isn't just to improve dietary health, but also to shrink what they see as a swollen welfare program. So the dietary health agenda of the MAHA movement might be pushed aside to some extent by the SNAP shrinkage motive of the MAGA movement. We don't know where that's going to end up. Yeah. But very quickly, one final concern I have is with the limited promise of any attempt to improve dietary health in America through the SNAP program alone. Only 12% of Americans participate in the program. So even if you make gigantic improvements in the dietary health of SNAP recipients, the other 88% of us are still surrounded by unhealthy, ultra-processed foods and still consuming those to excess. Yeah. So we need a broader focus than just SNAP.
Yeah. So thank you for raising all those points and really helping us understand, you know, the challenges and things on both sides. I will say that having read the USDA approvals for all the waivers, they're actually quite detailed on the required evaluations. And so we have to see if the states will follow that. But USDA was very clear that these programs have to be evaluated. They're waivers. They're testing a new approach. We have to see what's the impact on SNAP recipients, what's the impact on their lives, what's the impact on purchasing, what's the impact on their health. I think that's important. I will say, Rob, for the complexity of scanning, right now, SNAP doesn't allow any hot prepared foods, but allows cold foods. And so you can go get a burrito that's cold and microwave it in a 7-Eleven, but if there's a burrito under a warming lamp in the 7-Eleven, you can't buy it. And so SNAP is able to navigate, I think, the complexities of UPC codes. So I'm not worried about that. And I actually, one of the states, I think, actually helped reverse that and said not only can SNAP recipients not buy soda or candy, but they can buy healthy hot food like rotisserie chickens and other things. So I think there's an opportunity to improve the program. Jennifer, what are your thoughts on the states and what they're doing kind of around ultra-processed foods and their innovations?
So the states are definitely the leaders. They're seeing a gap in historical FDA oversight over the ingredients. Dari talked about the GRAS loophole, but also historically, not this administration, but before, the FDA has not had any type of framework, a comprehensive framework or a resource framework to evaluate the ingredients that are already in the food supply. And so they're not well resourced to do so either. So what that means is that it has taken decades for the FDA to actually remove ingredients that we know are associated with health harms. Red dye 3 made national news. They removed it from cosmetics for being associated with cancer in 1990, but then waited till last year or this year to actually remove it from the food supply, despite the Delaney clause, which says that we have to get cancer-causing ingredients out of the food supply. There's other things. Brominated vegetable oil took 53 years to remove after evidence of health harm. Industrial trans fats, 30 years, even though the Institute of Medicine told us to reduce it, 20 years ago. So we have, in the face of this lax post-market environment, the states have really jumped in and are protecting us. As we heard about West Virginia, there are about 30 states with similar bills as West Virginia's both trying to remove the food additives from school foods or from the states. Some very innovative labeling laws. Texas has one of the best labeling laws that came out of this movement, and other disclosure laws. So one of the things I was really heartened to hear Senator Marshall saying that he doesn't want to stop this state movement. And this is what we in public health, we really want to encourage the states to continue. And preemption, which is removing the state's right, we're not there. This is not the place for it. For 120 years, the federal and state governments have been concurrently functioning on food safety. It would be unprecedented to remove the state's ability to oversee food safety. Remember, the food industry is already selling products that have removed the ingredients that West Virginia is seeking to remove in other countries while exposing Americans to the same ingredients. They can engage in different marketplaces. And also, there's just not any type of track record yet for the FDA to be the sole arbiter of food safety. We have to, there's resources FDA needs, additional authorities, regulations. So we're not even there yet to say that we should be removing the state's authority.
Yeah, thank you, Jennifer. I think that preemption is what industry is going to push for the federal government to sort of pull back on the state's ability to do this. So Kyle, as the person who's come into FDA to really lead the human nutrition program and all of the issues around nutrition, which, by the way, I think if I not going to get it wrong, the budget's around $100 million, and most of that's for food safety, not for actually nutrition. I think the budget for nutrition is even smaller, out of a $7 billion FDA budget. So the F in FDA is very tiny, and we need that F to be bigger and better resourced. But in the last few minutes, first, maybe you can comment on ultra-processed foods and what your agency is doing about ultra-processed foods, and then maybe next about GRAS and this issue of the GRAS loophole, because I know you've thought a lot about both of these issues.
Yeah, thanks, Dari. And I want to give a thanks to the Food Tank and Food as Medicine Institute as well for the invitation today. Look, there is a chronic disease epidemic in this country. I like to call it a national nutrition crisis that we're trying to solve. We've taken significant action already on dyes, eliminating all of the petroleum-based dyes that West Virginia has also worked on. Talk about GRAS reform. We have put out an RFI earlier this year to define ultra-processed foods. That's something that we really think we need to do at the national level to help usher in some of these changes. That comment period closed in October. We got about 19,000 comments on that, so we're working very quickly to analyze those comments and work on next steps. I can tell you that as a whole of government approach, defining ultra-processed foods and tackling these issues is a priority for this administration, a 2026 priority. We're doing work with NIH. My friend Dr. Jay over there and I have worked on a nutrition regulatory science program. We'll have some new announcements coming soon on that, but we're really excited to be able to use that program to fund some research on things like how do ultra-processed foods impact the gut microbiome. So there's a lot of work that we're doing and that we want to do. GRAS reform is another one. One thing I do want to say is that the Human Foods Program at FDA has a vast remit. We regulate 80% of the food supply in this country, 230,000 facilities, 30,000 farms. We assist over 500 recalls a year. And we do all of this on a budget that's about half the size of the Dallas School District's budget. So a relatively small budget given the vast federal remit that we have. And so this is not a problem, this chronic disease problem, diet-related chronic disease problem we have in this country. It's not something that we can solve alone at FDA. It really does take Congress. It takes industry, academia. It takes consumers to continue to advocate, to look at food labels. We're seeing data now showing that over half of consumers are actively looking at food labels. Those are the highest numbers we've ever seen. And we know that companies will respond to how consumers use their pocketbook, even more so than what we can do from a federal perspective. We are absolutely committed to doing things like front of pack labeling, defining ultra-processed foods, closing the GRAS loophole. All of these changes on both the nutrition, the food chemical, and the microbiological food safety side. But I just want to stress that this is something that will take a societal movement to continue to advocate for. I think the work that Secretary Kennedy has coalesced under the MAHA umbrella has helped push this. But to be successful, this will take years of continued buy-in by all sectors, by private industry, by consumer groups, by government, by Congress. And we do have to work on the reform. So we're really excited about the work we're doing. If I could just spend 20 seconds on grass. We have proposed at Secretary Kennedy's request earlier this year to reform the grass loophole through regulation. We also know there are several bills pending in Congress to also close the grass loophole. So we're taking a two-step approach where we're going to try to do that through rulemaking. We've got a regulation, an NPRM that's pending at OMB to close the grass loophole. And it's something that we're really committed to. It's a priority of ours, and we're hoping we can execute on that in 2026.
So, the list, if you're not in this space, the list of things that Kyle just described that they're doing have been on the public health nutrition agenda for 30 years and have not been addressed. And so the fact that Kyle and the FDA and Commissioner McCary are actually addressing these things and planning to do it, and there's rules at OMB, is pretty remarkable. And the other thing I'll say in closing is that, we worked quite a bit with Congress in the last administration. We worked quite a bit with agencies in the last administration and in this administration. I really think this is the one theme that has crossed administrations unchanged. Both administrations, the prior one and this one, really wanted to address food and think about food and nutrition through different ways, through different means. But this is not a partisan issue. Health is not a partisan issue. We have a broken healthcare system. We have a broken food system, and we have a broken agricultural system, and those three things are tightly interlinked, and they're all fixable. They're all fixable. So thank you so much to the panel. Really great to have your expertise here. Thank you for what all of you are doing in your ways to address this problem. Thank you.